we'll do today, we'll talk about what does the kidney doctor see as to why they want me to start dialysis, Stephanie. Because if I could tell you the number of times I've been called to the hospital to educate a patient who just found out they have kidney disease like 2 days before. And they want me to go to the hospital and give the person the full spiel of what healthy kidneys do, the creatinine level, the GFR level, symptoms, and do all of that in a 30-minute session. You can't imagine if you're a person who's living their life, going about life, and then all of a sudden you get sick and you think, okay, I just have the flu, or oh, I just got bronchitis, oh, I might have pneumonia. I just got pneumonia. Let me go to the hospital. They're gonna give me some meds and I'm gonna be good to go, right? These people are honestly thinking that that's all that's wrong with them. But when they get to the hospital and the hospital does a thorough evaluation of that person's health, they find out that they have kidney disease. Kidney disease is such a life-altering, life-changing diagnosis. It's life-changing. And so they call me in, Steph, I need you to come talk to this person. I'm like, sure, I'll come talk to this person. So I'm giving this person the spill of healthy kidneys to needing dialysis. And so a lot of times when I meet people in the hospital setting, they're like, look, these folks don't know what they're talking about. All I got is bronchitis because I've been coughing for the past 3 weeks. And I'm like, no, boo, you got more than that. Okay, so in this video, this was a long introduction, I know, but I had to do it that way. So in this video, I'm gonna tell the patient, I'm gonna pretend you're the patient or you're the family member of the patient as to why the kidney doctor is saying what he's saying. Because you have probably watched my preceding video, so you kind of have heard of the creatinine, you've heard of the GFR, you've heard of some of the symptoms that I've talked about. You remember the 5 stages of kidney disease that we talked about earlier. So you have all this information, right? So meet the patient. The patient's like, look, only thing is wrong with me is that I got the flu. I'm like, yeah, you do have the flu, but you got kidney disease too. So this is what the doctor is seeing. The doctor in the hospital is able to do, all the labs they need to do. They're doing all the calculations they need to do. They're looking at the person's symptoms. They're looking at the person's medical history. And this is what the doctor has come up with as the solution to what's going on. When the doctor wants to initiate dialysis, it's because of about a few things. Number one, the person has an extremely high creatinine level. For instance, if you're a long-term diabetic and you present at the hospital with a creatinine of 8, we already know normal creatinine is 1, right? That's normal. So if your creatinine is 8, the kidney doctor is well within their right as a medical professional to offer dialysis. It would be malpractice not to offer it, okay? So an extremely high creatinine level, the doctor is gonna wanna initiate dialysis, right? Another thing that could be extremely high, the blood urea nitrogen. Normal BUN is between 6 to 19, roundabout normal, depending on muscle mass, how old you are, and that sort of thing. If your BUN is like 60, 70, the nephrologist is well within his right as a medical professional to offer dialysis. It would be malpractice not to, correct? All right. You have on a lot of fluid. Your blood pressure is sky high. The nephrologist's job is, of course, to try to normalize the blood pressure, because sometimes normalizing the blood pressure and other things will kind of get the kidneys in the right direction. Sometimes, not always, but sometimes. So if your blood pressure is extremely high, your creatinine is high, the GFR is low, all of those things, the kidney doctor's like, wait a minute. If I don't do an intervention, this person could die, or that has happened before. So those are some of the things that the kidney doctor is seeing in the blood work, in the person's labs, as to why they want to initiate dialysis. Another thing could be if your potassium is extremely high, your creatinine is extremely high, your GFR is extremely low, are other things as to why the kidney doctor wants to initiate dialysis. especially if you have a history of kidney disease. If you have a history of kidney disease, you've been ignoring the doctors, then you show up at the hospital on Sunday, they see in your medical records that you're a kidney patient, and they see that all these things are wrong that I just named, they're well within their right to want to initiate dialysis. Because remember, they're treating you based on your symptoms that you present. And so with the symptoms that you present, most nephrologists, 9 out of 10, are going to want to initiate dialysis or correct whatever deficiency you may have, whether it's blood pressure, whether it's potassium, whether it's sky-high blood sugar, whether it's you have too much fluid on your body from something else. They're going to want to normalize those things to see if that can correct the kidney function. Because sometimes it's not going to take it all the way back to stage 1, but it may stabilize the kidney function where your GFR, instead of being 6, may go to 16. You know what I'm saying? So it may stabilize it and improve it a little bit, but if those things are wrong that I mentioned, the creatinine is sky high, the GFR is very low, you have a lot of fluid on, you have shortness of breath, you can't breathe, your heart, all those things, they can't let you go home like that. That's why they want to initiate dialysis. And so those are the types of things that I explain to the newly diagnosed kidney patient in the hospital, so they can understand this is why the doctor is doing this, because a lot of times they don't understand the background of the healthy kidneys, of the creatinine level, of the GFR level, to know why the doctor would want to even talk about this. What's the big deal? I just got a bunch of fluid on. Once I get the fluid off, I feel better. Okay, so I hope that this video hasn't been too wordy, because my goal is to make short videos that people can understand and benefit from. So if you like this video, please subscribe to my channel. If you want me to tweak anything or change anything, or if you have a comment or you have a specific topic that you want me to discuss, please comment below. And if I'm able to accommodate your request, I will certainly make a video on whatever you suggest. Like I said, subscribe, share, like, and I really appreciate you taking the time to watch my video. And thank you. Bye.